Welcome to episode 1 of podcast series Be Beautiful, Be Influential, where we help you to become both beautiful as well as influential both inside out. Hi, I'm Dr. Geetika Srivastava, skin expert from AIIMS and founder of Influennz Skin and Hair Clinic in Delhi. Anti-aging is a growing concern. If you think about it, a newborn is not as old as an infant and an infant is not as old as a toddler. We are continuously aging. But along with the wisdom and experience, we also want to age gracefully. That's why I have in my podcast as guest Dr. Tornike from Georgia, who is a renowned plastic surgeon there and is also a medical advisor with Aptos Threads since past many years. So over to you, Dr. Tornike. First of all, welcome to our clinic. Thank you for the beautiful training that you did. But at the same time, there are so many questions in my mind which I want to ask, and I want to understand your perspective as well. So, doctor, first tell me that why do you think that the patients are coming to us for anti-aging services in general? And do you think, because you're a plastic surgeon, do you think that there is a shift from a more surgical approach to a non-surgical and semi-invasive approach to looking younger?
Hello everyone. Hello Dr. Geetika. Hello dear viewers. So it's my pleasure being here first of all in India, and of course beautification and any procedure that is done by cosmeticians, dermatologists, by plastic surgeons. This is something that from which our patients expect to become more beautiful, to have natural looks, to change something in a good way. So we should always beware, we should always take into consideration that all this should be done in the way so that our dear patients, they don't lose their naturality and their beauty. That's why we have so many options, right? Even in aesthetic field, there are a lot of different options, starting from some injectables and, for example, like a threads that we have done today. So, as for the plastic surgeon, I always prefer to choose right candidates for the right methods. There are a lot of choices, and we should use those choices to give them beautiful and nice and natural results. So we can do some facelift, for example, for some of our patients, surgical facelift, I mean. But for some of them, if they are 35, 40, 45 years old, and it's too early, we don't see little signs of ptosis on the face, we have an alternative. We can do some fillers, we can do Botox, and we can do the threads. So what does the threads in general do? With threads, we can remodel and reshape the face. It's mini-invasive procedure, and we need 10-15 minutes around this, maybe sometimes more. It depends on the patient, on the zones, how much zones do we treat. And so what do? We just reshape the face and we turn all the tissues in the position where they were before. For example, 3, 5, 7 or 10 or 15 years ago. So easy, fast to give them nice result, but with minimal efforts. That's why we choose sometimes for some indications the threads, and as we already have seen for today's cases, we had amazing nice results, reshaping of the face as well as elimination some wrinkles on the face.
So doctor, you told me that we do fillers, Botox, threads, also energy laser devices also for patients. So when do you prefer doing threads for them, and when do you prefer doing filler? Then even if you combine them, how do you combine them?
Okay, threads and fillers is one of the best combinations. Let's start from this. And why? So we can lift and we can fill. So the combination of two. If I see that there is the sagging tissue, and I know that with the thread, with the help of the thread, I can lift this saggy tissue in the position where it was before. For example, 5 years ago. I will do the thread, and after some time, when the swelling and all this is gone, and I see the final result, for example, 2-3 weeks, maybe sometimes 1 month, okay, I'm gonna use the filler for the specific parts where I see that thread was not enough. So to make the differentiation, if there is something that we need to fill and like give the volumization without any lifting effect, we just put the filler there. If there is some areas where I have the saggy tissues and I know that I need to lift them up, then I do the threads. And if there is both, I can combine, and the combination is always the best solution. But we usually try to start with threads, lift the tissues up, and then just correct some parts of the face where the filler is needed and the thread was not enough.
How I like to feel, doctor, that there's an hypertrophic aging in which the tissue is sagging down. Let us lift up the thread, and the atrophic aging, which volume deficit, fill up with fillers.
Absolutely.
And threads and fillers should have at least a month gap.
So the month is the ideal
Scenario.
scenario. But in case, for example, I don't know, some of the patients, they don't have time, they're flying somewhere else or something like this, we can do it even simultaneously, like doing the threads and then adding some fillers. But in this case, the doctor should be very experienced, because we should see where do I have the swelling and where I actually need to add the filler. So another scenario is if we do it after 2 weeks, 10 days or 2 weeks. This is minimum gap, because most of the swelling is gone, maybe not 100%, but around 70-80% is gone. So at least I can do something. But let's say that 1 month is the best.
So remember, if you are looking for getting threads and fillers all at once, please ensure that the doctor is experienced. Only then they will be able to make out that there's an area of volume deficit or there's an area of swelling. The next question, doctor, is that what about threads? And why Aptos? Why are you so much of a fan of Aptos threads? Tell me about that.
So what I can say is that thread is thread in the term of it's not surgical facelift. So what we expect from the thread? We expect just mild rejuvenative effects and lifting effects. So when you are using thread, at least you should use the best. Now let me explain why is Aptos the best. First of all, it has its specially designed barbs that you won't find in any other companies, because this is patented barb. Those barb has almost parallel cuts to the thread itself. It's not a deep cut. It means that you remain the tensile strength of the thread. You don't make your thread weaker because of those cuts to make the barbs. And it means that also those barbs has much better fixation inside the tissues. If you see the actual histological photo of the Aptos barb, you will see how strong grip it has inside the tissues. This is the first reason. Another reason is the tensile strength and the absorption time. So what the materials we use for our threads is polylactic acid and polycaprolactone. As we know, polylactic acid is one of the best collagen stimulators as well. Additionally, we're having this threads HA, and I will mention hyaluronic acid later. So PLHCl 75-25. This exact ratio gives us the most of the longevity, the long-lasting result. It's almost 2 years, 24 months. When ideal threads, they are absorbed in 6 and in 8 months maximum. Of course, the result is 3-4 months max. If we know that if something has overall absorption time, for example, 1 year, it cannot lift the tissues for 1 year. No, it's less always, because after 1 year, all the thread is gone. So if we take, for example, in case of Aptos, if we know that it's 2 years, we know that the lifting will be there around 1.5, but not 3 or 2 months or 5 months, something like this. So longevity is another reason. And third reason, which is also very important for our beautiful patients, is that we have a lot of hyaluronic acid inside our threads. There are no any other threads on the market that consist of HA. So what does it do? We know that it's the best collagen elastin stimulator, rejuvenation of the skin, as well as some patients maybe have dryness of the skin. So moisturizing, rejuvenating, and giving much better quality to the skin. So you have double effect. You do one procedure, you have biostimulator inside your skin, the tissues, and also you get amazing skin lifting result and face reshaping. So those are the reasons why we choose Aptos, and we have a lot of products to treat each zone. For example, for the jaw, for the marionette, for nasolabial fold, we have different products, and also we have universal products that can treat all these zones together.
And on top of that, it's a US FDA approved thread.
Yes.
That means it's safe as well as pet.
Our threads are USA approved, so of course it means that the quality and the guarantee that we can give to our patient, they will have long-lasting and amazing results.
So guys, if you're looking for a thread that can solve almost any of your aging concern, a thread which is versatile, has longevity of up till 2 years, is safe, effective, only go for Aptos Threads. But doctor, please tell me that about the company Aptos. You told me, but I want you to tell the audience as well, that's a very old company. And I think it is one of the pioneers in threads.
Yes, so the first idea was from 1978. It was Georgian plastic surgeon, well-known prominent plastic surgeon, Dr. Marle Suamanit. And he was the first ever doctor who created the threads. So all the threads you see now on the market, all the PDO, the coil threads, all the other threads, they came after the Aptos. So Aptos was the first ever company that used thread lifting to lift the tissues and remodel reshape the face. So it started from 1987, then it continued with the first patent when we got in 1996, the first Aptos patented bar. And then was huge way of the development, and the good example that our company does not stop even now is that recently last year it was presented the Namica, a fourth generation Aptos thread with special nanomicro submicro encapsulated hyaluronic acid which consists of 25 times more HA than in the previous generations. And also there was huge route for the Aptos company, like creating first and second and third generation threads, first absorbable threads, first threads worldwide with HA. And so it has huge history, and the main aspect of this history is that the company Aptos is a pioneer, is the first who ever started thread lifting and made the threads with the barbs.
So it's a company that has been started by literally the father of threads, right?
Yes.
And it has constantly evolved themselves, because there has been first, second, third, and now currently the fourth generation threads. So even the threads that they were present before, they were the best, but now the current threads are even better than the best.
Yes.
Yeah.
Absolutely.
Doctor, I just want to ask that in your practice, because you have been doing many patients of anti-aging and as well, how many of that proportion are undergoing for threads?
The patients who undergo this procedure, they can repeat it as many times as they want. And why? This is another difference. Our cannulas are very thick. That's why we work with sterile gloves, we work with sterile drapes, and we clean all the face with Pethidine, as you've seen today, because we have to touch the cannula itself. It's very thin. It means that it's not traumatic. And even though you, of course, caused some of the fibrotic tissues, there is healthy fibrosis. It's very little amount of connective tissue there. And if you repeat this procedure for the same patient twice or 3 or 4 or 5 times, you will see that you feel something there. Yes, it's a little bit agroic tissues, but you don't struggle to go through the tissues. But I have done Aptos to the patient that was treated by some other threads, and it's like almost impossible sometimes to pass through the tissues. So this is another difference. Doing this procedure as many times as they want until they are patients for the surgical facelift, or they decided to do the surgical facelift. And also this myth that after the threads you are not able to get the surgeons are not able to do the surgical facelift, or For example, if it's nose threads, they cannot do the nose job. Also, this is not true when we are talking about Aptos. And I do it to my patients that then undergo the facelift. And I can compare the difference between some other threads where you really struggle to dissect the tissues and to have nice mobilization. And in case of Aptos, when the fibrosis there is tiny and very thin, and you might take 5-10 extra minutes for it, but nothing special. So
doctor, in your practice, what are the most common 5 indications you are doing with Aptos threads?
With Aptos,
yeah,
5 indications.
What all areas are you treating?
Okay, so there are almost for any area on the face and even on the body, there are some threads and some methods. That's why we have more than 30 products, more than 50 methods. So we can treat the eyebrows, we can treat the nose, mid-face, lower face, when there is atrophy on the cheekbone or nasolabial folds are too much pronounced. We also can treat the jawline. We have specially designed threads specifically for the jawline, as well as we can do some combinations to get even better and better results. Also the double chin, the nose, the ears as well, and the body, because we have the threads for the tummy lift, for breast lift, for thigh lift, even for the arm lift. Okay, so we can do all this using Aptos. We have all the products in case we have some kind of mild ptosis or severe ptosis. The patient is 35 or patient is 65, 70 years old. We have the solution for all these patients. And of course, we can do some combinations for some of them.
So it is safe to say that we can treat almost any concern with Aptos thread and on every age to build that.
The most important is choosing the right product and choosing the right candidate. I don't mean that everyone is the candidate for thread lift. No, but we can find those candidates in any group, in any age group. But if someone is the candidate for the thread lifting, we have the possibility to treat almost any zone.
So can you also tell our audience, doctor, that if somebody is looking for a thread, they now know that Aptos Threads is the best. But how are they going to find a good injector who can do that treatment for them? How to find the right doctor who can do that procedure?
So first of all, that's why we do so many trainings, and we train the doctors all over the world. So I had in 5 days, I have traveled 3 countries, and now India is the 3rd country, and continuing almost 10 days trainings here.
And we asked you to do a podcast with all jet lag. So sorry.
No problem. So my pleasure. So the main idea is that someone who is doing Aptos thread lifting at least should be trained, because this is not something that you can just watch and repeat. At least you should do one hands-on, one training. So after doing several trainings, after doing several treatments, then it's very easy, because when you have someone professional who is doing this and giving you right tips and tricks, you understand how the thread itself works, all the biomechanics and all the anatomy of it. And then everything is easy, because all the doctors that we are going and training, they're professionals in their field. They know how to work with injectables, they know how to work with cannulas, how to fill the subcutaneous fat. They just need a little tips and tricks from this specific products. So answer to your question is that patients always should search for the trained and certified doctors who has done the trainings and who is doing a lot of cases. And of course, they will get amazing results, and they should.
So I think it's a take-home message for the audience that if you have hypertrophic aging, you now know that, for sagging skin, you need threads. And now you also know that you need Aptos threads, because worldwide it is best. It is present in how many countries?
Oh, nowadays it's more than 100. It's like
more than
103 countries.
More than 100 countries it's available. But now it's your duty to find the right doctor who is also trained with Aptos threads. with that, we should end the podcast. Thank you so much, Doctor. It was very insightful. All your answers were amazing. Thank you so much for taking out time after being so tired for this podcast.
My pleasure. Thanks to the audience, thanks to everyone. So I hope to see you next time and do a lot of advanced trainings and maybe even some collaborations and working together. So
thank you so much, Doctor. So if you are also interested in more such podcasts, comment podcast in the comment section below. Till the time, be beautiful, be influential.